Morning, good evening. Hello, everybody. Thank you for joining us today for today's webinar on RECAP, which stands for Research and Evaluation Capacity Assessment Tool and Resource Package. Today's webinar is being presented by the Data for Impact Project, or D4I, with funding from USAID. And today's presenters will be Jessica Farringer, the director of D4I, Aaron Lubin, previously the acting director from Data for Impact, who has since moved on to another organization, Susan Petrick, senior technical specialist and D4I team leader from ICF, Kristen Brew, senior evaluation specialist with D4I, and I'm Liz Millar. I'll be moderating today's webinar, and I am a research associate with D4I. Today's agenda will go as follows. So once we go through the introductions in the agenda, I will hand it over to Jessica, who will give a brief overview of the D4I project and how RECAP fits into the project's goals, as well as those of USAID. Aaron will then share some background about the tool's creation and development. She'll hand it over to Susan, who will provide a review of the content and structure of the resource package. Kristen will then take us through the pilot experience, so some more practical aspects of RECAP there. And then we've saved about 10 minutes at the end for discussion and questions, and I will moderate us through that. And I forgot I was going to turn on the video so that you could see us all here in the room. So let me do that briefly. We're just going to say hello, and then we'll turn that off so that we don't steal the bandwidth. So hi, everyone. Good morning, good evening. I'm in the room here with Jessica, Aaron, Kristen, and this is Liz, and then Susan is joining us remotely as well, so you can see her there. And just before we get into the content, we'd like to take a minute to acknowledge the many people who have contributed to this resource package. So those include individuals from D4I, including Gabby Escudero, Bridget Adamu, Becky Wilkes, Tori Taylor, Christina De La Torre, Maya Alva, and Deidre Rogers, and then also formerly from D4I, Ashley Strawley, Wendy Zhang, and Emily Weaver. We'd also like to thank the Nepal Evaluation and Assessment Team, or NEAT Nepal, as well as GEMNET, the University of Ghana, and a number of Ghana and Nepal expert consultation participants and reviewers, all of whom are acknowledged individually in the RECAP user guide, if you'd like to take a look at that. So now I'm going to turn off, I've already turned off our video, great. And I'm going to hand it over to Jessica for the overview of D4I and RECAP.
Thank you, Liz.
Are you left? Oh, there.
Sorry about that. Okay. For those who are unfamiliar with Data for Impact, or D4I, we are a USAID-funded cooperative agreement and an associate award of measure evaluation. You can see here the different aspects of our work. We generate strong evidence needed for program and policy decision-making, and we do this through either the use of available data sources, such as routine health information system data, or through generation of new data, or a combination of both. We also work to strengthen individual and organizational capacity to generate and use evidence, and that is obviously particularly relevant for the presentation today. And we facilitate and enhance the use of data for global health programs and policies. There is increasing demand for accountability and rigorous research and evaluations of health programs. And this has increased the pressure on national and regional organizations to conduct high quality research and evaluations. So RECAP has been designed to support local organizations to rapidly assess their technical and management capacity for conducting research and evaluations. RECAP also supports users in creating actionable plans for institutional strengthening and is designed to help strengthen country and organizational capacity to address country health information gaps and to receive direct awards from USAID and other funders. Many of you may be familiar with the USAID draft local capacity development, or LCD policy, and be considering how RECAP may be able to support implementation of the policy. So the policy notes 3 different types of tools USAID uses for capacity strengthening. There's those that identify and manage risk, those that catalyze the process of capacity strengthening, and those that measure performance improvement as a result of the process. RECAP is a tool in that second category that catalyzes the process of capacity strengthening. So it allows organizations to assess strengths and gaps and identify their own priorities for capacity strengthening. It illuminates for USAID and implementing partners the type of capacity strengthening needed, and it can be used to help set benchmarks for performance strengthening. And lastly, it identifies resources to contribute to strengthening. And with that, I will hand things over to Erin to give us some background on the tool.
Okay. Thanks, Jessica. I don't have, oh, I do, sorry. Okay, so we know that there are many assessments for organizational capacity assessment and for M&E assessment, but few are specifically, we found few for specific to research and evaluation in global health. So, and what we did find, many of them were assessment tools for individual knowledge. We were really interested in looking at capacity at the organizational level. So we acknowledge that there are a lot of tools out there. We include a list of these tools in our resource guide, along with a short description of the purpose for each of those. And in the resource package with the resource guide, you can use those tools, you can review those tools and look at them to decide which is the most appropriate for your organization. We acknowledge this might not be the appropriate tool. There might be something that works a little bit better for you. And then in the resource guide, we also include some low cost and no cost options for capacity strengthening, which is a little bit unique to this toolkit. So it was very important for us to not duplicate the efforts of the other tools that existed. And so our starting point for this was the framework and toolkit to strengthen evaluation capacity that was developed under Measure Evaluation. That's also known as the ECS. And the ECS did meet the needs that I identified, but there were some changes in the context and in the environment between when that was conceived and when D4I started. So first, there was the introduction of the Journey to Self-Reliance and PEPFAR's commitment to allocate 70% of funds to local partners by the end of fiscal year 2020. D4I also had transition awards as part of the project. So we felt that there was a need to assess the organizational competencies somewhere between the ECS and a full organizational capacity, or an OCA. So in addition to that, after a lot of years of investment in routine health information systems and population-based surveys, there's been a push to use these data for evaluation whenever possible. So we wanted to be sure to explore the capacity to use routine health information systems and other secondary sources, and also qualitative methods. So while the ECS is very flexible, it allows for adaptation, we also found that there was interest in having more defined competencies. So we used the ECS as the starting point. We reviewed additional relevant frameworks and tools, and then we consulted with experts, starting with our USAID management team, our project leadership, and then moved on to hold expert consultation meetings with research and evaluation experts in both Ghana and Nepal from university, government, and research organizations. So this is the ECS framework for strengthening evaluation capacity, and this was our starting point. We included all of the dimensions and subdimensions in RECAP, but they've been organized a little bit differently based on feedback from our consultations. So for example, we split human resources. We felt that evaluation design really needed its own domain for this particular tool. And then we combined the staffing and leadership with the organizational resources. Technology is woven throughout, gender integration is cross-cutting. And when we moved around some of the pieces for data collection, analysis, and use. We did use many of the discussion guide questions from the ECS as probes in the RECAP tool. Okay, so our first consultation was in Ghana in November of 2019. We sought feedback on experiences using various assessment tools. We reviewed the domains, subdomains, and core competencies of this framework, and then we identified some of the resources that are commonly used and gaps in those resources. So we split people into groups of those who had conducted assessments on other organizations and those who had had assessments conducted on them to get a sense of what their preferences were. And they had used a combination of self-made internal tools and then other commonly used global goods. Overall, what we found is that they really preferred comprehensive and holistic tools that took context into account and were adaptable. And one of the major concerns with doing assessments that sort of was across the board was the amount of time and money required to do these kinds of assessments. In Nepal, we had to contend with COVID. We had planned on doing a similar kind of consultation and were unable to because of COVID. So whereas Ghana was done as a one-day in-person meeting, this was done remotely. So we had a virtual 2-hour orientation meeting, and then the experts provided their feedback in writing using the worksheet that you can see here. And then we had a consultant in Nepal who followed up either one-on-one or in small groups. The main objectives for the Nepal consultation were to seek input on the scoring approach and then to review the package as a whole to get feedback on if the user guide was helpful and if the resources were sufficient enough to implement it. Some of the findings there was a request for simplification of language or translation, and they felt that gender integration wasn't sufficient. They wanted to include other intersectionality, so caste, ethnicity, geography, and socioeconomic status. And then they felt that the scoring approach, while very subjective, was also sufficient to paint a picture of the strengths and needs for capacity development. And the user guide and the resource list they found to be helpful. We had a few comments on that we adjusted. So after that, we conducted 3 pilots in 2021, one in West Africa, one in South Asia, and one in East Africa. And Kristen is going to focus on those in her presentation. But for now, I think I will pass it over to Susan.
Thanks, Erin. I'm going to move us, from this background and the consultations and the piloting process to the present day, where we now have a finalized and publicly available recap resource package. I'm going to first describe the 5 individual resources that make up the package, and then I will go over what the assessment tool looks like, how the scoring works, and how to move from assessment to planning for institutional strengthening. On a personal note, I would just say that I've really enjoyed working with the D4I team on the recap assessment tool and resource package. I've been working in and around the USAID development space for many years now, and increasingly just, really appreciate and focus on that undertaking research and evaluation thoughtfully is really quite important. Having data and information you can trust is a key part of understanding progress and impacts. As you will see, there's a lot of detail associated with the assessment tool and the overall package. Having to think things through to this level of detail with this work has really helped me to hone my own research and evaluation skills. I hope equally that this tool will be helpful for organizations seeking to enhance and expand their capacities as part of working to have a larger role in research and evaluation activities in their own countries. Next slide. In this table, we have listed the 5 individual resources that make up the package. First in the list is the assessment tool, which is in a sense the centerpiece of the resource package. The assessment tool, as the title implies, is the tool an organization can use to assess its own organizational research and evaluation capacity. The tool's terminology is similar to what you see in many assessment tools. The terminology works to organize and describe what is being assessed. Specifically, what is being assessed is organized into domains, subdomains, and core competencies. There are the core competencies are assessed per a 4-level scale in relation to a performance ideal. Second on the list is the Excel workbook. The workbook is what an organization would use to record their scores for each core competency within the individual domains and subdomains. The workbook is preloaded with formulas to calculate scores and visualize that information. The workbook also guides the user to prioritize areas for capacity strengthening and also lay out a plan to do so. The next three resources, the user guide, institutional strengthening resource guide, and facilitation PowerPoint, are each accompanying resources designed to help an organization carry out their capacity assessment. The user guide, for example, describes the role of a facilitator in conducting the assessment, as well as other steps an organization would follow to undertake their assessment. Next slide. In this tool, there are 6 domains. On this slide, the rows shaded in dark green are the domains. By domain, we mean a broad area of expertise. As you can see, the domains are comparable to the phases of a research study or evaluation. Below each domain, the subdomains are listed. The subdomains break each domain into parts. We can also think of subdomains as specialized skills and capacities. It is not shown on this slide, but each of the 17 subdomains then consists of several core competencies. There are a total of 67 core competencies. It is the 67 core competencies that are being assessed against a performance ideal. When an organization chooses to use the recap assessment tool, they can choose to focus on all 6 domains, or they can pick and choose certain domains. As noted on the right, gender is a cross-cutting theme for the tool. Indeed, in each of the 6 domains, gender integration is included as a core competency at least once. Next slide. Here, I wanted to show in more detail what we mean by core competency and performance ideal. In this example, on the top of the screen, we are looking at the research and evaluation design domain. This domain has 3 subdomains: overall development, sampling, and tools. Circled in red is the subdomain overall development. This subdomain has 6 core competencies. Now, if we move to the bottom right of the slide, we are looking at a single core competency, needs identification. This is under the subdomain called overall development. In the shaded box is the performance ideal for the needs identification core competency. Scoring for a core competency is in relation to the performance ideal. As outlined in the recap user guide, the approach is a facilitated self-assessment. That is, staff from the organization would choose to complete the assessment with the assistance of a designated facilitator. The prompts noted here are what the facilitator would use to guide the group through assigning their score for each core competency. Thus, all 67 core competencies have a performance ideal and prompts. Next slide. Let's look at how the scoring works. As I mentioned previously, a 4-level scale is used to score each core competency. The 4 levels of the scale are referred to as nascent, emerging, advancing, and expert. A score of 1, or nascent, would mean the organization has very limited experience and knowledge of the core competency, and that they would struggle to meet the performance ideal. A score of 4, or expert, would mean that the organization meets the performance ideal. Recap assessment is designed to be a consensus building exercise for an organization. Through discussion, likely with the designated and external facilitator, selected staff from an organization collectively agree on a score for each core competency. The recap user guide outlines options for an organization and how to approach this assessment. Most likely, the approach would be to convene a workshop or a small group discussion with participants representing different aspects of the organization. Next slide. With the recap scoring, it's quite important to be thoughtful about the purpose of scoring and what the scores are and are not used for. The overarching purpose of the assessment process is to set priorities and establish a plan for institutional strengthening. The scoring is only to be used to help facilitate this process. As noted on the left, The recap scores are used to provide a snapshot of an organization's technical and management capacity to conduct research and evaluation, to inform discussion around an organization's research and evaluation capacities, and to visualize capacity gaps and help prioritize institutional strengthening activities. As noted on the right, the recap scores are not used for funders to judge performance or compare organizations, nor should they be used to measure progress on specific projects or activities. Next slide. Once an organization completes the self-assessment and enters the scores in the Excel workbook, then it is the Excel workbook that becomes the primary tool. Again, the assessment could be in relation to one domain, several domains, or across all 6 domains. The Excel workbook generates a dashboard to help with reviewing the results. The workbook also includes space for notes, including notes about the evidence and rationale behind the score for each core competency. Both the approach to scoring and how the workbook is set up is to help an organization prioritize their needs and think through strategic decisions in terms of, for example, staffing. Also, prioritization might be in terms of what types of research and evaluation work an organization does and does not have the capacity to pursue. In setting priorities, an organization can design a plan and establish action items. With the plan and the follow-up, it is of course important to define roles and responsibilities, lay out a timeline, and put procedures in place to monitor progress. As part of planning for institutional strengthening, the recap resource package will be useful. The recap resource guide will be useful. The guide includes resources both in the form of documents as well as links to free or low-cost training opportunities. Next slide. Here, I've pulled a couple screenshots of pages from the Institutional Strengthening Resource Guide. On the left, you see a list of tools around the broad topic of capacity assessment tools. The value here is for the user to see other tools, other assessment tools that might work well in combination with the recap. With the rest of the guide, the resources are organized by domain and subdomain. So on the right is the start of the list of resources in relation to domain 1, research and evaluation design. For each resource listed, there is both a link to the resource and a brief description of the resource. In the resource guide, there are nearly 100 resources included. I hope that this overview of the research package has been clear. There's a lot of information to take in, and having me as a single person sort of talking at you with this information. However, I do think that once you look at the tool and the resource package, you will find that it is easy to work with and really largely self-explanatory. And so with that, I'm going to turn things over to Kristen, who will share some lessons learned from the 3 pilots undertaken in 2021.
Thank you, Susan. So as we've discussed, the recap can be used as an internal process for collaborative development of a capacity building strategy with a local research partner. And it can also be used as a means to monitor, evaluate, and learn from those capacity strengthening activities and support the local partner in tracking their progress in their institutional strengthening work. Many of the organizations that D4I partners with on research and evaluation activities are interested in maximizing the opportunities of our collaboration to expand their research experience, provide professional development opportunities to their teams, and strengthen their institutional capacity in specific research and evaluation competencies. Strengthening the institutional capacity of partners to conduct research and evaluation is a focus of D4I. And as such, in the beginning of engagements with in-country partners on larger studies, we typically go through a process of assessing institutional strengthening opportunities and then creating an actionable plan for institutional strengthening within the scope of our activity. Then at the end of the collaboration, we do another assessment to help both the partner organization and D4I document any changes.
we wanted to pilot, sorry, I gotta take my mask off. We wanted to pilot the recap with different types of organizations, different sizes, different levels of establishment, and different strengths and priority domains. We also wanted to implement the pilots as parts of ongoing evaluation work whenever possible, given the desire to strengthen local capacity through our collaboration, as well as limited budget for capacity building activities. And this necessitated learning by doing. So we targeted 3 organizations, the first in West Africa, which I'll talk through in more detail. This local partner is a well-established private research organization that specializes in monitoring and evaluation, research, mapping, data processing, and training. In South Asia, we worked with a small membership-based nonprofit agency supported by ad hoc consultants and volunteers. And in East Africa, we worked with a well-established team at a university research center. Framing the purpose of this package and the utility of the results was critical to securing the buy-in and meaningful engagement of the local research partners in the recap piloting process. And so we frame this process as laying the foundation for institutional strengthening. So it is of value to gather the team to conduct the process, to talk through and assess the critical elements for implementing effective research and evaluation activities, using these discussions to identify areas that need strengthening or further development, and then prioritizing those identified needs and designing an actionable plan for institutional strengthening. There are 2 key outputs to the recap process, as Susan talked through. The first is the completed assessment workbook. This includes a results snapshot dashboard at the subdomain level, and embedded within the notebook or the workbook are notes and comments on how the scores were reached, as well as evidence or a notable lack of evidence behind competency score determination. The second output is the institutional strengthening plan. And again, this talks through organizational capacity needs and priorities, identified strategies and action steps to meet these needs, as well as a timeline and resource requirements, and then a plan to monitor progress for institutional strengthening. And today I'll present results from a pilot that we implemented with the local research partner on a multi-activity project outcome evaluation. We shared the assessment tool and other recap materials with the partner team, along with an initial proposed list of the modules that we felt applied to our work together to help the partner decide who should participate and to know what to expect from the discussions. We focused the first part of the assessment on those core competencies that were directly related to our scope of work with the partner. And then we encouraged the partner to identify additional competencies that they were also interested in assessing and strengthening. And we discussed that even if these additional competencies were outside the scope of the scope of work, that we would support them to conduct the assessment and identify capacity strengthening resources that they could use or pursue on their own. We structured the scope of work focused assessment and planning as a series of 2.5-hour group meetings that were held in person at our in-country project office. And then some staff and D4I staff joined remotely. The first session, we went through an orientation to the assessment process and mechanisms, and we completed the first half of the assessment workbook. Then on the second meeting, we completed the remainder of the assessment workbook and initiated institutional strengthening planning processes. We had 13 partner staff attend the sessions, and this included 5 staff at the director level. We also had staff from operations, logistics, administration, programming, and accounting. This is a quick look at Domain 2 fieldwork assessment results. So we can see team mobilization. We had a pretty high subdomain score, 3.6 out of 4. And you can see recruitment and training, they ranked themselves slightly lower than piloting, planning, and relationships. Team mobilization, they felt that they had strong quantitative skills in this area. Gender integration could use some work. And then for team mobilization under field work, they had the highest score. And again, gender integration, they ranked themselves the lowest. A couple of key quotes that we had pulled out from the assessment discussions were around team mobilization, training specifically. We would like to grow our training activities on tablets. Previously, we've only trained with paper, and we're open to receiving technical assistance on modern technologies. And they also gave some feedback on piloting and safety during data collection. We also looked through domain 5, information sharing. Here with translation, they felt that they had very strong gender integration in translating research results into communicable products, but they identified some needs around interpretation. And then in dissemination, they scored themselves slightly lower on writing and then gave themselves the lowest score for action planning. Gender integration across information sharing domain, they scored themselves high at a 4. For interpretation, a lot of the discussion focused around a need for gaining qualitative data collection, analysis, and reporting or communication skills. For gender integration, again, they felt strong on this. And then lastly, dissemination or writing. As individuals, we have done a lot, but as an organization, we've not done most of these things. For example, journal articles, conference presentations, development blogs, and there is a need to move further. And so in response to this, the organization prioritized some of these gaps that they had identified, and we talked through the scope of work with them. And in order to help promote institutional strengthening within our scope of work, we've tried to engage the local partner more in report write-up, in review of technical analysis documentation, as well as in stakeholder dissemination, organization, and presentation. So a couple of key lessons learned from the pilots across the 3 countries. First, obviously, preparation is key. You can't just sit down and open the workbook and expect to hit the ground running. One of the first decisions is when in the relationship with a local partner to implement the assessment. For example, as D4I working with a local partner, we found that the assessments have included more open and reflective discussion once we've worked together for some time. It's best to have a point person from within the organization co-lead the assessment. And then it's important to include participants from varying content areas and levels of seniority within the partner organization. Next, for scoring, in some of the pilots, we found very high assessment scores, which in retrospect shouldn't have necessarily been unexpected. For example, in the West Africa pilot, we implemented the reduced assessment tool focused on competencies related to the local partner's scope of work with D4I. Well, we hired the partner because they had expertise in these areas. So it shouldn't have been surprising to have high scores in these areas. It's also important to note that the scores are subjective as organizations are rating themselves. They may not know about skills and knowledge they don't have, so they don't know what they don't know. Also, there might be a perception of a power dynamic if D4I staff are participating in the assessment, and so the partner may feel more constrained about having to rate themselves higher if they feel that they're talking to a funder. But this gets back to the earlier point about conducting the first assessment after you've established a good working relationship. And then lastly, this idea of sleeping capacity within an organization and ownership, they came up in multiple pilot experiences. By sleeping capacity, we mean that staff have skills and experiences individually, but the organization has not had the opportunity to demonstrate these abilities within their funded work. And then lastly, the structure of funding systems has limited local ownership and agency. With this, we'll turn over to Liz for a summary.
Thank you, Kristen. So now we have heard a bit about the overview, the background, the structure and components of recap, as well as the pilot experiences in brief that Kristen described. I just want to take a minute to note that this webinar recording and as well as the slides will be available and shared within the next day or so with all registrants from the webinar. So we've had a couple questions about that, so just to address that. And I've dropped this link into the chat, but this is the URL for where recap and all the various components of recap can be found: the user guide, the assessment tool, the Excel workbook, the resource guide, as well as a facilitator PowerPoint that can be used for the assessment workshop. I also want to note that there is a forthcoming pilot report, which will go into a bit more detail about the pilot that Kristen described, as well as the other two, for those who are interested in learning more about the practical experience. We'd also like to note that recap is intended to be a living resource. So the intention is to make updates to various components of the package as needed. So if you use or review the recap tool and have feedback or would like to tell us about your experience, we would like to hear that. Please reach out to us. There's some links on the D4I website on how to reach out to us as well. So now we are going to take a look at the questions that have come up already in the question and answer section. If you do have a question, please use the Q&A function on Zoom to input it. We'll also keep an eye on the chat just in case. But we're going to go through the questions now. So the first one I'm going to direct towards Jessica first, and then if others want to jump in. And that is a question from Christine. How does a local organization request/receive capacity building support from D4I?
Thanks, Christine. So Data for Impact works at the request of USAID missions and USAID headquarters. So if your organization is an implementing partner with USAID, and we have a request from a mission to potentially work with you, or you are subcontracted through Data for Impact for one of our research activities, that's how capacity strengthening would potentially work with us. But you cannot, as a local organization, come to D4I directly and ask us for support. It has to be through a USAID request.
Thanks, Jessica. Did anyone want to add anything?
I would just, I guess, follow up that we've tried to design the assessment package and the user guidance so that local organizations can implement this themselves. As Jessica mentioned, if they need more, in-depth technical assistance, then it would have to go through USAID. But we wanted this to be a standalone global good that organizations could use for themselves.
Thanks, Kristen. Okay, so the next question, did you notice if the areas demonstrating low capacity are those with which clients typically do not ask local partners to work on, e.g. research design, analysis, reporting and dissemination, and vice versa? Mainly local partners are asked to collect data. So I'm gonna turn that to Kristen first, and then others can add as well.
I think that it's a good point that, a lot of the data collection responses were strong scores. I think in the West Africa context, I don't think that we directly assessed research design, but there was discussion around a lot of times the scope of work or the protocol comes from D4I or would come from the funder or whoever's subcontracting out the work. And oftentimes the local organization isn't asked for feedback. So that's one area where there's an opportunity to engage with research design, protocol development is to actively seek the input of the organizations in that process. But I can't recall that we had, for West Africa, that we had assessed that. In East Africa, I think there was a bit stronger research design because we were talking with a university research center. And so they had, academic backgrounds and more diverse research experience. So those scores were a little bit higher.
Thanks, Kristen. Anything others would like to add?
Hi, Liz. This is Susan, just to add a quick point. I think in the context of USAID's increasing interest in locally led development, I think part of the interest in the way forward is that local organizations would be involved in the research design. I mean, that's what the intent of the policy is. So a resource package and a tool like this is to help prepare those organizations to be able to do the work that they haven't been doing in the past.
Thanks, Susan. So the next question, I'm also going to start with Kristen for this one. To what extent does the application or did the application of this tool improve the institutional capacity of the organizations in the pilots?
So these two were implemented last April and one in November. And so we haven't moved through an entire scope of work with any of these partners yet. I would say for West Africa, we have already been engaging them. They were interested in learning some additional quantitative analysis or having the opportunity to conduct and present that. And so we've pulled them into some coached, mentored opportunities within the scope of work to analyze data that they've collected and to pull that together into slide decks and eventually a report. And I think we've also had some more structured efforts around engaging them in qualitative data analysis and results communication. We've also built in time for larger stakeholder dissemination, product review, and back and forth with the local partner before submitting to USAID. In East Africa, we've had a request for some qualitative training. And so we had a specific qualitative tool, I think it's Deduce. And so we had some D4I staff help coach the local team on how to use Deduce. And then they were able to participate in qualitative data analysis and write-up. And then we also, a couple weeks ago, had a dissemination event at the country level, and one of the local organization staff presented the qualitative results there instead of D4I staff presenting it. So we've been intentionally moving along some of these areas identified in the institutional strengthening plan, but again, we haven't hit the end of the scope of work with any of these groups yet.
Great. Any other comments from our panelists?
And just to know, I think the timeline on that where we would have more information is another year and a half out from now.
Thanks, Jessica. The next question, where does knowledge translation capacity fit under the recap? So I can answer that question, and I will drop the link to the assessment tool into the chat in just a moment so you can have a look yourself. But under domain 5, information sharing, there is a subdomain 5.1 focused on translation. Anything else to add there?
No, I think it's really that translation piece.
And there's the link to the assessment tool itself, part of the recap package. The next question, how does this tool compare to other MERL organizational capacity assessment tools, if others exist? What is the value add relative to other tools? Erin, do you have any thoughts on that?
Yeah, thanks, Liz. So what we found was a lot of the tools were very specific more to the M&E and less to the research and evaluation pieces. Some evaluation tools that are out there focus really specifically on individual capacity versus the capacity of the organization to conduct research and evaluation. And then the organizational capacity assessments tend to be much more focused on things like HR and finance and the operational side of things. So not necessarily the capacity, again, of the organization to conduct research and evaluation. So this is sort of a hybrid.
Thanks, Erin. And unless other panelists have comments on that, please speak up if you do. The next question is the tool, I think it's asking, is the tool an open tool? Please correct me if I'm wrong, but yes, this is an open tool in that it is publicly available. All parts of the tool are now available on the D4I website. That's the link that I dropped into the chat earlier. And if there's another part of that question, please clarify and drop that into the Q&A. Would be happy to answer that.
This might not be directly related to open, like open access, but related, it is adaptable or adjustable. So the Excel workbook and the tool itself is designed to be adaptable. Like we saw with the West Africa pilot, we didn't use the entire 6 domains. We picked domains that were specific to the scope of work and the interests of the local partner. And then within those domains, you can, focus in on specific subdomains, specific core competencies. So it is adaptable, and you don't have to fill out the complete workbook in order to get a results dashboard and get usable information for the institutional strengthening plan.
Thanks, Kristen. Our next question is from Heidi. Do you think it could be used as a monitoring tool, example to monitor improvements in capacity over time? So who would like to start with that question?
I guess the first thing that comes to mind is that these are subjective self measures. And so sometimes when you're starting out on something, you feel very confident and you have really solid footing in this area that you've worked in. And then as you engage more deeply with the material, you realize there's a whole lot that you don't know. And so once you start to learn more about a specific research or evaluation competency area, you might realize that there's a lot more to learn, so your score could go down. So I think that the numeric scores aren't necessarily helpful for monitoring quantitative change over time. But again, within the workbook, there is documentation of how you give yourself a score. Like, for example, our organization does XYZ as evidence. We have these 3 documents. And so you can review that historically to see how you've progressed over time.
Yeah. And I think that's especially important because we know that, people change organizations and people leave and come in new. And so you might not know why the previous group of people selected a certain score. So the context is really important, and that notes section is very important.
Anything else panelists would like to add?
Sure, Liz and Susan, just to add a couple of thoughts, I agree with Kristen's point. You do have to be careful. You can't think of these scores the way you think of sort of a quantitative metric or indicator. But I definitely felt in working on this tool and sort of increased my awareness of how common like 3 or 4 or 5 level scales are. Like they just exist in a lot of things that we do, in a lot of ways that we think. And so this type of scoring, I think, can be useful for an organization in some of the ways that Kristen said, like what notes did you scored yourself, for example, a 2, and sort of what notes did you take about that score? And then in your mind, you sort of think, okay, well, what do I need to do to be a 3? Like what are the things that would change that? And so I think in that informal way, it does work as a sort of self-monitoring technique. It sort of is on your brain what your score was.
Thanks, Susan. Any other thoughts about that question? So the next question, what is the time investment to plan, implement, develop action plan approximately, and the number of people involved? So I will say there's some light guidance about this in the user guide. There's a step-by-step process that recommended to be followed in terms of planning for a recap assessment. And obviously that will also vary quite a bit based on the number of people at an organization, how many domains are going to be assessed. For example, in the West Africa pilot, we saw they only looked at 2 domains, whereas in the East Africa pilot, they looked at all domains. So that would usually take a bit longer. Any other guidance or comments on this particular question from our panelists?
I think it's also how many staff end up participating in the assessment. If it's a small number, it can just be one large discussion. Whereas if it's a larger group of staff, you may end up breaking into smaller subgroups and having, report back or have like vote by consensus. And so it also might depend on the size of the assessment group.
In our West Africa pilot, my memory is that it was 2 sessions of like 2.5 to 3 hours each, right? And we had we had a consultant in country that assisted, and then we had several of us here in the States as well. So
Yeah.
for that, but that was also a limited number of sections that we assessed. It was
And then there was a
2
little bit, a couple extra hours of follow-up for
Mhm.
prioritizing and articulating that full strengthening plan.
Mhm. But we do have, I'm not sure if it's posted as of yet, we have a document that talks about those experiences with the pilots that notes some of those timelines for the different organizations and considering what we've looked at with the different organizations. So that might be helpful for folks to reference when thinking about planning and timelines.
Yes, it's not yet available, but will be linked on the recap landing page in the next couple of weeks with those additional resources. And I would just add, to answer the question more concretely, I think for planning, at least a few weeks, ideally a month, to think about what the structure, what the process will be like, who will facilitate. The implementation of the assessment, I think, can vary depending on size and all the other factors that we've discussed, including, is it virtual? Will it be in person? Is there an event already planned that it could coincide with? That sort of thing. And I would just highlight that developing the action plan is very important to have a dedicated time for that. So in addition to just conducting the assessment, the assessment is sort of a means to the action planning and the plan for institutional strengthening. So very important to make sure there's a dedicated day or slot or whatever the timing works out to be for that particular aspect. If there's no other comments on that particular question, I'll go on to the next. And I know we have about 5 minutes left, so we'll get through as many as we can while we have everyone. Is the tool used for use with research institutions, agencies? Do you have a sense of the extent to which the tool can be used with other types of organizations, particularly community-based organizations?
I guess I would say if the community-based organization is conducting research or evaluation work, then the tool could be used for them. They would still have the same management and staffing structure where you'd have management, human resources, financing to look at, as well as different skill sets throughout the other 5 domains. And so I don't see why this couldn't be used with a community-based organization.
So for some more context on the groups that we've used it with so far, one was an academic group based at a university. Another was a private research group. And then the third was a private research group that is sort of a consortium of researchers. So it was a couple different types of organizations, but I agree with Kristen that it could be used with other organizations as well, just obviously those focused on research and evaluation.
Great. Thank you for that. The next question, did the local organization co-facilitators feel comfortable after participating in the pilot to repeat the assessment in the future without D4I assistance? Do the pilot organizations have specific plans to repeat the assessments? So I can give a brief answer to that to start us, and then others can add. But the most recent pilot that was done with an organization in East Africa, they did tell us at the end of the assessment that they felt that they would use it again independently. They felt comfortable and confident enough to be able to do it themselves. I will note that at the front end of that, we spent most of the first day of the workshop going through the tool and spending more time with the organization, familiarizing themselves with it. So that did take some time, and probably a little bit more time than we planned for, just discussing the tool and really having all the participants understand the different aspects of it. But then by the end, they told us they felt it was a valuable exercise as an organization, and they would want to repeat it themselves independently in the future. Anything to add from other panelists?
The South Asia group had mentioned that they felt that, they realized there were sections of the tool that didn't apply to them as they currently function, but things that they wanted to work towards or to become more competitive, or the space they were trying to move. And so they felt that it helped them to think through like structuring or hiring, or who they would want to focus on for staffing and skill sets, and to conduct it again in the future once they were larger.
Thanks, Kristen. I think we have time for maybe one or two more questions. So I will move on to, have you thought of integrating this as a technical area within broader organizational capacity assessments that local partners may be doing, such as under the new partner initiative? Do any of the panelists want to tackle that question?
For the new partner initiative, are you talking about the USAID policy
It's related.
related?
It's
Yeah.
related, yeah.
Okay.
I mean, if you are doing assessments to engage a new partner, this could be part of that package. And it would need to be organized. It would need to be done along with some of the other tools like the OCA, things that get more at management capacity and whatnot. You wouldn't want to do this alone. So I think the idea of integrating it, yes, that could definitely be done. We are not working with any organizations where we have had to do broader assessments, looking at management capacity, budgeting capacity, et cetera. So we have not done that ourselves, but definitely others could use this along with other tools that are not research and evaluation focused. I don't know if you have any thoughts on that.
Yeah, I agree. And I think that because this is modular and you don't have to do the whole thing, what I would do is I would remove the operational capacity pieces of this tool if you're already doing a new pass or an OPA or something of that nature.
Great, thank you. And did you observe any organizational turnover during the piloting? Did it affect the validity of the assessment? We're shaking our heads no.
We did have in East Africa, the director of the center was retiring, but I believe that happened before we implemented the assessment. And we actually had some discussions around the timing of the assessment so that it could be used as onboarding or like a reset after the director had retired for people who were taking that up. But we didn't have any turnover that I'm aware of during the assessment or immediately after that would have affected like the implementation of the plan.
Yeah. But again, why it's really important, and you sort of anticipated that, and why it's important to keep those notes instead of just the scores, because there will be turnover.
So we're right at 10 o'clock. So I just want to take a minute. We have one more brief question that I'll give to our panelists. But for those who do need to hop off, I want to be respectful of time and just say thank you very much for joining us. We'll make sure to get the links out to the recording and the resource to everyone who registered for this. And thanks so much for your time. It was great to have the questions and the discussion in the chat. And one last question, is this tool specific to health, or can it be used for organizations conducting research in other sectors like agriculture, nutrition, democracy, et cetera?
It's very broad. It could be used for other sectors. Part of one of the country's scopes of work that we piloted was in education. And so it certainly can be used for multiple sectors.
Yeah, I agree.
Yeah, I agree. I would say just take the time to go through it and make sure that you modify it accordingly.
Right. Yeah, there might be some additional aspects, say for agriculture and nutrition, that you would need to think about that wouldn't be included in this. So like Erin said, just think about it critically, but some of the more big picture things I think definitely could apply. So thank you very much. We appreciate your time. And any panelists, any last comments or anything you'd like to say before we sign off?
If you do find that you use this, we really would be interested to get your feedback, as Liz mentioned at the start of the webinar.
Yes, absolutely. I mean, we'll include that, I think, when we send out the link to the recording, how to get in touch with us. If you have used it, we'd love to hear about that. So thanks to everybody in the room. Thanks to Susan, who's joining us remotely. Thanks to Chris for helping with the technical side of things. And thank you to all of the participants who have joined. We hope you have a great rest of your day.
Thanks, everyone.
Thank you.